Every time we go to a doctor, see a dentist, or even fill a prescription, we are telling a tiny part of our healthcare story. But our story is incomplete, broken into pieces. Bringing all of those pieces together could transform care. 3 years ago, HealthShare of Oregon set out to do just that.
What we want is to have people look at the whole view of any particular member that they're serving, and having access to meaningful data is really the key to that.
This is Graham Bolden. He's the Director of Health System Performance at HealthShare of Oregon. He's part of a team that's developed HealthShare Bridge, which compiles the data from the more than 320,000 members into a single database.
So when you have that much data, what it enables you to do, and something that we would like to be able to do, is not just start telling people about what's happened already, but to start using that information to predict what it is that's going to happen, either for any particular individual or for a system as a whole. You can do a lot by looking at all of the data, all 300,000 of our members, but where the magic, I think, really happens is as you start to break it down and look at some of those smaller populations.
If you're just looking at the overall information, you're never going to know which communities you're serving well and which ones you aren't. You're just going to get to know overall what's this look like, right? So by pulling that apart, by kind of peeling back the onion, it just starts to unravel kind of where are there particular and specific issues or opportunities with this population.
Data available through HealthShare Bridge helped identify one population in particular that was being overlooked: foster kids.
Sometimes kids are coming into care and we don't know when their last assessment was, or the last time they saw a doctor or a dentist.
This is Megan Ochoa. She works for the Department of Human Services in Child Welfare.
They were just removed from their parent, which is really traumatic. And so it's really important for professionals to be seeing that child with a lens of trauma-informed care.
Knowing this population had historically been overlooked, HealthShare and its partners were able to work together to ensure these kids got the health care they needed in a way that addressed their specific needs.
HealthShare's been really at the forefront of understanding this population and how high needs they are, and how important it is to serve them on multiple levels, and how important it is to serve them up front when they first come into foster care.
In addition to pinpointing areas to target health and community services, HealthShare Bridge also helps direct the spending of limited resources in smarter ways.
We have a saying that if you don't measure it, it doesn't get better. Those metrics really help us have targets so that we can overall say, this is improving the system. And then we try to address that at a systems or at a community level.
It allows us to then begin to work on how we're affecting population or community health while still paying attention to where the cost drivers are now, which can often, it makes sense as a first focus, but a lot of folks get stuck there just thinking about what's driving our cost right now. And HealthShare really looked above that and said, and how can we be working towards a better system that is more effective?
And that's really at the forefront of healthcare transformation, is looking at the entire picture of what any member or a particular community may be experiencing, to then start changing the way that we deliver care and the way that we engage with communities, which is really what the CCO model is all about.
To learn more about Bridge and the other ways HealthShare of Oregon is improving outcomes for those most in need, visit healthshareoregon.org.